about CPR on dogs. Right now we're gonna start off with an overview of what we're gonna be learning today. When we use CPR on an unconscious animal that is not breathing and has no pulse. And why we are learning CPR, we are going for our Red Cross certification in pet first aid and CPR. We also need to talk about safety. We need to make sure that you are in a safe place to be doing CPR on an animal and that you stay safe with the animal. Like don't get bit and making sure that they are actually unconscious. Then we'll be talking about positioning the dog to do CPR. We position the dog on its right side, so that will put the heart up for your compression, so the dog needs to be on its right side. And then we will be talking about actually performing CPR and going through the motions and what you need to do. So those are the things we will be talking about today and learning about. Again, I said we are working towards our Red Cross CPR first aid and pet safety certification. There are a couple things you will need to do to get that certification. One of the things is you will need to view this video and answer the questions that accompany it. You will also need to successfully use the Animal Care Technologies training modules on pet first aid and CPR. You will also need to pass my assessment with an 80% or better. And you will also need to pass the dog practicum, CPR practicum in class. And we will be using these two mannequins in the classroom. We will be utilizing this video, our Red Cross books in class that you have in class, and again the Animal Care Technologies training modules. So those are the three things we will be utilizing to gain your CPR certification. So that is what we're going to be doing and why we're going to be doing it. So let's get started.
When do we do CPR? We do CPR when an animal has stopped breathing and has no heart rate or pulse. If the animal still has a heartbeat or a pulse, you can do rescue breaths, but you should check to see that the animal is not choking on an object, and then you would go to the choking section and do the abdominal thrust, the wheelbarrow, or the back blows. So we do CPR when the animal has stopped breathing and has no pulse. That's when we start the rescue breathing and the compressions. Safety and anatomy of the dog. Safety is first and foremost for you. You need to make sure that you are in a safe location before doing CPR on a dog. Many dogs get hit by a car, and that may cause you to have to do CPR in that situation, but you need to make sure that you are safe first. Then you may need to review the anatomy of the dog. The dog needs to be on its right side, so it needs to be laying on its right side down, which would put its heart up for the compressions. Reviewing the respiratory and the circulatory system would be a good idea.
This is Melanie Montero with another Safe Dog Safety Tip. Today I'm going to show you how to do CPR, something every pet owner should know how to do. If your dog stops breathing and his heart stops beating, performing CPR is the best chance you have for saving his life. Before you begin, make sure the dog is laying on his right side so that his heart is facing up. You also want to call out for help because your best chance for success is if somebody can drive you to the vet while you continue to perform CPR in the car. Your first step is to establish an open airway. To do this, open the mouth and pull the tongue forward. You might need to use your shirt or a cloth to get a good grip on the tongue to pull it forward. Have a look inside the mouth and make sure there's no foreign matter. If you can see something clearly, you can use your finger to sweep it away. Make sure the head and neck is aligned to create an open airway. Next, you want to look, listen, or feel for breath to be sure that the dog isn't breathing. You can watch for the chest to rise and fall, or bring your face down to the dog's mouth and look, listen, and feel for breath. If he's not breathing, give 4 to 5 rescue breaths right away. Hold the snout of a larger dog closed and seal your mouth around the dog's nose. On a smaller dog, your mouth will naturally seal around the dog's nose and mouth at the same time. Breathe in just enough so that the chest begins to rise. Don't overinflate the lungs. It looks something like this. Be sure to let the lungs deflate completely in between breaths. Next, you want to check for a heartbeat or pulse before you begin chest compressions. There are 3 places you can do this. The first is to feel for a heartbeat by taking the dog's front leg and bringing it back to the chest. The point where the dog's elbow meets the chest is the spot where you can feel the heartbeat. The second spot is the femoral artery, which is in the hind leg. Take your 3 fingers about the midway point down the leg and slide them toward the groin. And then feel for that recessed spot in the leg where the femoral artery runs closest to the skin. The third spot is in the dog's front foot pads. Place your 2 fingers just above the large middle pad of a dog's paw and feel for a pulse there. I find this to be one of the most difficult places to find a pulse on a dog, which brings me to my next point. Every dog is different, so it's really important that you know where to find the pulse on your own dog before an emergency like this happens. You don't want to be looking for your dog's pulse for the very first time in a life or death situation. Once you've established that there's no heartbeat or pulse, you want to begin chest compressions right away. Bring the dog's elbow back to their chest to locate the spot. Place the heel of your hand over the heart. Lock your fingers together, straighten your arms, and give 15 rapid compressions like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. On a larger dog, you want the compressions to go about 2 to 3 inches, and on a smaller dog, you only want to compress the chest about 1/2 to 1 inch. Now you know all the different components of CPR, so we can put it all together. Here we have an unconscious dog that's not breathing and has no pulse. We open his airway, pull the tongue forward, and keep his head and neck aligned. We begin with 4 to 5 rescue breaths. Then give him 15 chest compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Followed by 1 rescue breath and 15 compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Continue the cycle of 1 rescue breath per 15 compressions. Just keep it going and check for a pulse and signs of life about once per minute or after every 4 cycles. You can continue your CPR efforts for up to 20 minutes and be sure and try and get to the veterinary hospital as quickly as possible. For more tips on how to protect your dog, check out the Safe Dog Handbook on Amazon or visit thesafedoghandbook.com. I'm Melanie Montero, wishing you and your dog a safe, happy day. See you next time.
is the equipment we will be using in class to do CPR. We have two different types of dogs here. Here we have our general stuffed animal dog that has a tongue that you can pull out. When you are practicing on this type of dog, you need to just pretend and cup the mouth and nose when you blow into the dog, and then feel free to do the compressions on this stuffed animal. Now we have our CPR dogs, and we should have two of these in the classroom. These dogs, you will be able to feel a pulse, so you can practice feeling a pulse in the several different areas of the dog. You will also be able to use these dogs to breathe into, and the chest will rise. So we have some removable nose pieces here, and we have upper and lower respiratory tracts that can be taken out and sterilized as well, so that we can all practice on these dogs. So that is the two different types of animals that you will be learning CPR on in the classroom. So cardiopulmonary resuscitation is used to treat animals that are not breathing and do not have a pulse. First, when you come upon an animal, you need to check and make sure that it is unconscious. So you need to stimulate the animal and see if it responds. If it doesn't, you need to look to see if the animal is breathing. You can do this by looking to see if the chest rises and falls. You can also get your head down and listen to see if the animal is breathing. Then you need to check for a pulse. There are several different places that you can check for a pulse. Above the paw in the front leg, above the paw in the back leg. You can listen to the heart, usually using a stethoscope. The easiest way without using a stethoscope, I feel, is the femoral artery. And you use your two fingers, you go up in the groin area of the dog, and you feel for a pulse there. So if the animal is not breathing and does not have a pulse, then you know you need to do something. You do, however, need to make sure that you are in a safe location and that you will not get hurt while attending to this animal. So I want you to make sure that you are in a safe location. After you do that and you're done assessing the animal, it takes about a minute to properly assess an animal, and we will be practicing that in class. I will time you so you know if you're spending too much time or not enough time assessing the animal. If the animal is not breathing or does not have a pulse, then we need to go to our ABCs of CPR. The first one is A, and A stands for airway. So what we need to do is we need to extend the dog's neck and head to try to open up the airway, and then we look into the mouth to see if there's any vomit or an object blocking the airway. If you see vomit, you need to scoop that out. If you see an object in the animal's mouth or upper airway, you need to then go to the choking aspect of working with this animal. So we do the wheelbarrow, we do the abdominal thrust, we do the back blows. You do not try to reach in and grab it, because you can force that object even further back into the airway. So if you see an object, then go to the choking part that we will learn about in another portion of this first aid. So if the animal is not breathing, you do not see an object, then you place the animal on its right side so that we have the heart up. You extend the head and the neck, you open the mouth, you pull the tongue forward between the front teeth. We check for the object. Then we move on to the breathing, which is B for breathing. With small dogs and puppies, you can usually fit your mouth over both the muzzle and the snout area, and that's how you give your breaths. With medium and larger dogs, you need to close the muzzle and then you would breathe through the nose. You want to exhale and watch the chest rise. So we can do that with this CPR dog. So you close the mouth and then you go ahead and breathe. And you watch for the chest to rise. In puppies and smaller dogs, you have to pay attention as to how much you are exhaling in because you don't want to overinflate them. So you do need to watch the chest and pay attention in the breathing aspect. Now, if we have done that and we do 4 to 5 quick rapid rescue breaths, we look at the animal, we see if it's breathing, assess it again, see if you can feel a pulse. If you still do not feel a pulse and the animal is not breathing, then we need to move to the compressions and see for circulation. So the animal is on its right side, the heart is up. We kneel and face. You want the chest facing towards you. If you're doing one person CPR, you want to be on this side where the chest is facing you. You want to place your palm on the chest where the elbow comes back and meets the chest. So you pull the elbow back, which will be easier to do on our other stuffed animals, to where the elbow meets the chest, and that is where the heart is, and that's where you want to place your palm for doing compressions. For smaller dogs and puppies, you want to go ahead and put the other hand underneath the other side of the chest so that you can push together. But for medium, larger dogs, giant dogs, you're going to have to do 2-hand compressions. When we're talking compressions, there are some differences between smaller dogs and into your larger and then giant breed dogs. So with smaller dogs and puppies, that's less than 30 pounds, and you're going to have to do some guessing as to how much this animal weighs. This is an emergency situation, and you just have to make your best estimate. You will do 1 breath and 5 compressions for small dogs or puppies. For medium dogs and larger dogs, that's around 30 pounds to 90 pounds. So most of your dogs are going to fall in that range. You're going to do 1 breath to 5 compressions. And then for giant dogs, so those are going to be your Great Danes, your Mastiffs, your really big dogs. Anything above 90 pounds is going to be 1 breath and 10 compressions. You will do CPR for 2 to 3 minutes, and then you're going to reassess the animal, checking for the breathing, checking for the pulse to see if the animal has come back. While you are doing this, you do want to make sure that maybe somebody is going to get help, or that maybe somebody can be driving you to the veterinary office so that you can get this animal some oxygen and some medical care and some drugs in its circulation to kind of bring things back while you are doing the CPR.